Launched in 2014, the Global Health Innovation Accelerator, or Ghia, is an important partnership between the South African Medical Research Council and the international non-profit organization PATH. Through their work, Ghia speeds up the development and introduction of sustainable, high-impact health technologies that could save the lives of vulnerable women and children in South Africa by accelerating medical innovation.
Most innovations never see the light of day. The design of the piece of hardware that you're going to deliver is just one aspect of a much bigger pyramid. There's a whole process to get a product from innovation into production, and it needs a team. So what Ghia does is we go out into our partner programs and we find the best people to assist in innovation to see the light of day.
We found that we had a lot of very strong institutions, but the issue was that they were unbelievably fragmented and weren't really speaking with one another. So what we've done is we've worked to bring together the various partners to increase the amount of communication and collaboration between the stakeholders, which has had unbelievable results.
The research and development of new technology is an expensive process. In fact, some incredible healthcare innovations emanating from South Africa have been mothballed as a result. But now, thanks to Ghia, some of these projects have been revived and entirely new ones started.
The level of health innovation in South Africa is just astonishing, but it's always been such a shame that those haven't really made it to the marketplace and haven't driven real health impact.
Even if you have a brilliant idea, it doesn't necessarily mean it's actually going to be useful to anybody. There's no money in public health, so how do you put a product that's going to cost you millions to manufacture into public health where there's no money?
And so what we've done with this funding from Gates is create the mechanisms that are required to commercialize technologies and actually have those go into the marketplace and save lives.
With the help of investment from the Bill and Melinda Gates Foundation, Ghia is currently incubating 3 technologies which could have a profound impact on healthcare in the developing world. One such project is the UmbiFlow, a low-cost Doppler ultrasound that has potential to save thousands of lives.
UmbiFlow, it's very similar to a Doppler ultrasound technology. It really gives you a good indication of the blood flow between the mother and the fetus. And on a computer screen, you get a visualization of what that flow looks like. That's quite radical, it's really innovative, it's a really cheap product that can go out into the market, and it can be used by non-professionals.
A clinical trial of the UmbiFlow is currently underway at Mamelodi Hospital in Tshwane. The study is trying to determine the high rates of fetal mortality in the region.
We're one of the countries which has got the highest burden of stillbirths or babies dying. Majority of the babies that die in a group, we don't know why they die.
Our setting here is unselected patients, they're low-risk patients, so you'd expect them to have normal pregnancies, normal Dopplers.
We're finding that 1 in 100 will have seriously abnormal results, that if we're not detected or picked them up, that baby was at risk of dying.
Another important project being facilitated by Ghia is the uterine balloon tamponade, a device that stops bleeding in the uterus at a fraction of the cost of alternatives developed in Europe and America. This is a project that would not have been undertaken had it not been for the involvement of Ghia with developer Sinapi Biomedical.
What was identified through Sinapi is a really simple device. It's a balloon which gets inserted, and the innovation around that is really making it cheap and simple. It means that we can take the technology and get it out into the areas where it's needed. Again, remember, Sinapi are a bunch of engineers, and there's a lot of skills that they miss, marketing skills, commercialization skills. So we make these things viable.
It's an opportunity that they created for us. They funded us in the first year with the development of the product, and they also flew specialists in from all over the world to workshop that design spec. And then they bring in business expertise, they bring in connections, they bring in relationships, that we didn't have in the past. So we will not do these projects without their involvement.
Anemia testing is an important baseline in detecting malnutrition, HIV, TB, and pregnancy. Ghia is currently incubating a non-invasive anemia testing device from prototype to full production.
The anemia device is innovative because it's non-invasive. In this country, you need to be a registered nurse to take a blood sample. This device, you don't need to be a registered nurse, which means that we can train primary healthcare workers to do screening in the communities, and then those that indicate that need some kind of treatment can then come into the clinic.
Well, Ghia currently incubates 3 different technologies. With the funding that we've received from the Bill and Melinda Gates Foundation, we hope to be able to increase that to between 10 and 15 technologies within the next 3 years.
Ghia is not revenue-based, so if we develop technologies, we don't get any kind of kickback for the technology. We are purely reliant on impact, and impact particularly into public health.
Living in South Africa, we're just so close to the enormous need that there is within the health ecosystem, and it has just been such a privilege to work on driving health innovation, which clearly is the answer to saving lives and to improving the quality of healthcare locally in South Africa.